start.
Hello, my name's Karen and I'm a nurse and a midwife. I'm going to show you today how to do a bottle feed for a breastfed baby. This little baby is just over 3 months old. She's called Little Austin and she's absolutely beautiful. And Mummy has never given her a feed before by bottle. She's been totally breastfed and done really well. Mum would like to go to the gym, and so we're thinking about giving her a bottle for those reasons. So I'm going to demonstrate to you today how to give a bottle for a breastfed baby. Now there's a special way of holding them. I've been a midwife for a long time, and I'm going to feed her like I would feed a premature baby or a small for dates baby. So I'm going to hold her out in front of me, and we're using a pigeon teat on the Avid bottle. We're going to put the teat in her mouth and point it to the roof of her mouth. Now, not all babies take their feed really easily to start with, because it's obviously a very different technique and a very different swallowing technique. That's beautiful, Miss Austin. You are doing so well. Mummy's watching. She is. She is watching. Beautiful. What I'm doing is I'm just touching her chin there, just to help to encourage her how to suck. It's also good if somebody gives a bottle other than the mum, so maybe if Dad or somebody else in the family would give a bottle, and Mum would maybe be out of the room or out of the house. That's a really great idea. And expect to start with she might reject the teat, because like I say, it is a very different action to actual breastfeeding. But it's very good for giving Mum some independence, isn't it? Yes. And talk to the baby, look at the baby, and then we're more likely to have some success. So what I'm doing is I'm just pointing the teat, the nipple of the actual bottle there to the roof of her mouth, and I'm just massaging her chin very gently. This is how I'd feed a baby, like I said, it's premature, or a baby that's in special care. That is beautiful, well done. I'm holding her head up slightly so her body is slightly raised. That's it, beautiful. Doing so well. Mummy's so proud of you. She is. She's so proud of you. Did you think it was going to be this easy?
No.
No.
It's amazing.
Like I say, I've been feeding babies like this for 25 years.
That's fantastic.
So that's why. So we can show this to your daddy as well, and then he knows what to do, doesn't he? So you choose the time of the day when they're not so hungry and starving, and that's really important to do. So you choose a time like a morning feed, you're not likely to have the same success as if you do an afternoon feed or an evening feed. And every so often just take it out. We're going to sit her up, we're going to wind her. Bottles will take an awful lot more air in, and when I wind a baby, this is how I hold a baby to win them. There we go, beautiful. No burps at the moment, Karen. You continue? She's all okay. As you can see, she's not totally loving it, but this is what to expect when you first start giving a bottle. And this is her first bottle?
We've tried it probably about 5 times.
Yeah. And she's been like this, or
worse?
Worse.
She won't take it.
It's a lot easier this time.
Oh yeah. She's never.
Fantastic. So you can see how by holding her differently, looks a lot easier.
Yeah, mate. Yeah.
Yeah.
So it's coming back and
See, it's beautiful. You are doing fantastically well. You are. And I wouldn't expect you to take a full feed to start with. You never know. But you just work on it, and each day do it at the same time. And it does get easier. I know. I can understand what you're saying to me. She says, this is different, and I'm not quite used to it in this way. Okay, I can do. Thank you.